Hi, class. It's good to be back with our lectures again. We're on chapter 17, Diagnostic Electrocardiography. This is going to be a review for you guys because I think you have already pretty much completed um, this chapter. So we're going to do a review for today, and then you'll have your exam on tomorrow. Okay, start now. We're going to talk about single average EKG. This type of EKG takes up to 20 minutes, and it's where the machine will collect about 250 consecutive QRS complexes. It can be done either on a special machine or on the standard EKG machine with special software, and it shows the late potentials in the very large QRS complexes that arise from a damaged or scarred myocardial tissue. And it helps predict the risk of the patient having ventricular arrhythmias like VTAC or VFib. Stress testing is a diagnostic procedure that's done to determine the likelihood of coronary artery disease, and it provides information about how patent or open the coronary arteries are. The goal of stress testing is to increase the heart rate to a maximal level that increases the myocardial oxygen demand so that you can evaluate the EKG and subjective responses of the patient. The heart is stressed by physical exertion. The patient's usually put on a stationary bicycle or treadmill, or they may be given medication to increase the heart rate. Then the patient's symptoms are monitored as well as the EKG. And this, again, like I said, provides information as to how open the coronary arteries are. So my doctor says I need to take a stress test. I thought sitting in his waiting room surrounded by coughing children and 2 hours was the stress test. Okay, so what's the indications for stress testing? A patient that's post cabbage or coronary artery bypass graft or post angioplasty evaluation. For the diagnosis or treatment of exercise induced arrhythmias, follow up to cardiac rehab, or patients with a family history of heart disease. Okay, we're gonna go back. So, what are the absolute contraindications for a stress test? These are the people, you guys, that will you definitely don't want to perform a stress test on. And they're patients that have an acute MI less than 48 hours old. If they have uncontrolled symptomatic heart failure, unstable angina, symptomatic severe aortic stenosis, a dissecting aneurysm, or acute pulmonary emboli. Relative contraindications, these are your patients that the doctors are kind of on the fence about, um, in which they'll decide they'll have to weigh the risk versus the benefit. And these are your patients that have left main coronary artery stenosis, mental or physical issues that render the patient unstable to exercise adequately, uncontrolled tachyarrhythmias or bradyarrhythmias, severe hypertension, high degree AV blocks, such as your second or third degree blocks, electrolyte abnormalities, moderate stenotic heart valve disease, or hypertrophic cardiomyopathy. So, how do you prepare or tell the patient to prepare for a stress test? The single most important piece of equipment in performing a stress test is going to be your 12 lead EKG machine. Those leads will need to be secure. You may have to tape them if necessary. Women are encouraged to wear a bra in order to decrease artifact. To prevent nausea, don't eat a large meal for at least 4 hours prior to the test. Wear comfortable, loose-fitting clothing and shoes, and walking shoes. Take routine meds unless specified by the physician. And don't drink any caffeinated drinks. That includes coffee, you guys. So how's the stress test done? Resting EKG is done before all stress tests so they can get a baseline, and then you'll get a baseline vital signs with the patient lying and standing, in which you're going to make sure you get the heart rate, the blood pressure, and the respirations. The EKG may be done with the patient hyperventilating or breathing very rapidly to see if they have any ST segment or T wave changes. And the patient will then exercise on a treadmill, a bicycle, or arm bicycle, all while the continuous EKG is running. The target heart rate, the stress test is continued until at least 85% of the target heart rate is achieved, or the patient develops EKG changes or symptoms that require termination of the test. The target heart rate is 220 minus the patient's age. For example, if your patient is 60 years old, their target heart rate would be 220 minus 60, so you'd be looking for a target heart rate of 160. Pharmacologic stress testing does not involve exercise. It's done on those who have physical limitations, for example, those patients with amputations or elderly who cannot exercise enough to reach that target heart rate. An IV line is started and the patient is given intravenous dose of medication that causes the heart rate to climb to that target level. Continuous EKG monitoring as well as vital signs are checked, and you're watching the patient for any symptoms. Some common medications that are used are dobutamine, daritamol, or adenosine. Some commonly used protocols for the treadmill stress test is the Bruce protocol. It's the most commonly used for maximal testing. The treadmill speed and incline are increased every 3 minutes up to a total of 21 minutes. And these are just some other exercise protocols, the modified Bruce and the Naughton. So what's normal symptoms for the patient to be having during a stress test? Well, they may have decreased systemic vascular resistance due to the vasodilation, increased respiratory rate, sweating, fatigue, muscle cramping in the calves or the thighs, increased blood pressure, and J-point depression. A shortened PR interval on your EKG, tall P waves, lower voltage QRS complexes, or increased heart rate with shorter R to R intervals. So stress test is said to be positive if the ST segment depression is greater than or equal to 1.0 to 1.5 millimeters. That does not return to the baseline within 0.08 seconds or within 2 little blocks after the J point. And any downsloping is indicative of coronary artery disease. Okay, so here my doctor asked me if I'd ever had a stress test, and I replied, yes, it's called life. So what are the signs that you should terminate a stress test immediately? If that patient's having any ST elevation, if they're having sustained ventricular tachycardia, moderate to severe chest pain, especially if it's accompanied by ST segment depression or elevation, if there's a drop in the blood pressure more than 10 millimeters of mercury, along with other evidence of ischemia, such as that patient's having chest pain, and also you're seeing those ST segment changes. Technical problems with the monitoring system or the treadmill. The patient requests to stop. Now, if the patient requests to stop, you want to ask them why, because sometimes it could maybe something that can be done to resolve the issue. Because if you stop it and it's just, it is something, it's not something symptomatic that the patient was having. It was something that you could resolve, such as they wanted, I don't know, they wanted you to pick up something for them off the floor or something. Anyway, if it stopped, then you'll have to the test will have to be redone. So you want to make sure you ask them why. Now, if it's for them for any symptoms, they're dizzy, they feel faint, or diaphoretic, you definitely want to make sure you stop the test immediately. So what's the indications for a Holter monitor versus an event monitor? Your Holter monitor is designed to catch abnormalities that show up in the course of daily activities. It defeats the purpose if you curtail your activity. The Holter monitor is usually worn for 24 hours, whereas your event monitors can be worn for extended periods of time and they pick up sporadic abnormalities. It's a small device that the patient can carry around with them. Okay, that's all I have for you guys today. That's your review. So for your assignment, you're going to list 7 key points that you remember from the video. You're also going to study for your exam for tomorrow. And don't stress, you got this. And I will see you guys next time. Bye-bye.